Hello everyone, today we'll be reading about tennis elbow and golfer's elbow. First of all, tennis elbow. Introduction. Pain and tenderness at the lateral epicondyle of humerus due to non-specific inflammation at the origin of extensor muscles of the forearm is known as tennis elbow. Over here we can see that in the extensor compartment of the forearm, the muscles have there is pain and tenderness and non-specific inflammation and the origin of extensor muscles. Tendinosis that affects the common attachment of the tendons of the extensor muscles of the forearm, especially extensor carpi radialis brevis. Extensor carpi radialis brevis is the most commonly affected muscle uh, in tennis elbow, also known as lateral epicondylitis, but it is not an inflammatory condition. Etiology. Popularly associated while playing tennis, therefore known as tennis elbow, but more common in non-tennis players such as cricketers. Any activity that involves overuse of wrist extensors or supinator muscles and repeating the same motion over and over again, like twisting the clothes, making circular rotis and carrying heavy loads. Pathophysiology. The stage 1 of tennis elbow is acute inflammation, but no angioblastic invasion. Patient complains of pain during activity. Stage 2 is chief complaint of inflammation and some angioblastic invasion and pain both during activity and rest. Stage 3 is a chief complaint of inflammation with extensive angioblastic invasion. Rest is there are rest pain, night pains, pain during daily activities, etc. Clinical features. Tenderness, precisely localized to the lateral epicondyle of humerus. Pain is aggravated by putting the extensor tendons to a stretch. There is painful and weak grip. The tests for assessing the tennis elbow are first one is Cosen's test or Thompson's test. The wrist is extended. There is radial deviation and full pronation against resistance. Then there is pain at the anterolateral side of the elbow. Over here, we can see that the examiner is putting resistance and the patient, the wrist is extended. There is radial deviation and full pronation, and there is pain at the anterolateral side of the elbow. Second one is Maudsley's test. In this test, there is a restricted extension of middle finger, elicits pain at the lateral epicondyle over here, due to decrease in extensor digitorum communis. Third one is Mills test. When wrist is flexed, forearm is pronated and elbow is extended, there is pain in the lateral aspect of the forearm. And the last one is chair lift test. This one, chair lift test. The chair is lifted with thumb, index finger and middle finger, and elbow is extended. Then there is pain on the anterolateral side of elbow. Treatment. Rest your arm and avoid activity that causes your symptoms for at least 2 to 3 weeks. That means that there is no playing for 2 to 3 weeks. Put ice on the outside of your elbow 2 to 3 times a day. The patient is initially treated with analgesics or anti-inflammatory drugs for a week or so. If there is no response, then a local injection of hydrocortisone at the point of maximum tenderness generally brings relief. Over in this picture, we can see that there is a hydrocortisone injection at the point of maximum tenderness. Also, compression strap applied distal to bulk of extensor mass to reduce maximum contraction. It is used only during aggravating activity. This is the strap, compression strap. Next is golfer's elbow. Introduction. Inflammation at the origin of flexor tendons at the medial epicondyle of the humerus is known as golfer's elbow. Also called medial epicondylitis, causes pain on the inside of the elbow. Over here we can see that there is pain or there is tenderness on the inside of the elbow. Causes overusing the muscles in the forearm that allows you to grip, rotate your arm and flex your wrist. This is the Uh, this is the grip of a golfer. Repetitive flexing, gripping, or swinging can cause pulls or tiny tears in the tendons. Racket sports, where racket is small, heavy, or tightly gripped, and throwing sports, which have improper pitching techniques, can cause golfer's elbow. And occupation requiring strong hand grip and adduction of elbow, such as carpenters, have golfer's elbow. Clinical features: tenderness under medial epicondyle, pain when shaking hands, weak grasping, numbness and tingling from your elbow up into your pinky and ring fingers, pain when flexing your wrist. In this picture, we can see that over the lateral side is the tennis elbow, and over the medial side, we have golfer's elbow. And there is weak grip strength in both tennis elbow and golfer's elbow. Treatment: restrict activities and movement of the elbow and take adequate rest to gradually diminish the pain. That means no playing for like 2 to 3 weeks. Ice pack: application of ice straps for 15 to 20 minutes at a time, 3 to 4 times a day for several days. This is how you apply ice packs. The patient is initially treated with analgesics, anti-inflammatory drugs, and then if there is no response, then a local injection of hydrocortisone at the point of maximum tenderness, which is it's also done in tennis elbow. So yeah. Brace or compression strap: putting a brace on the elbow hinders free movement and reduces tendon and muscle strain. This is the strap of golfer's elbow. Actually, both of them are the same straps, but in tennis elbow, the strap compresses more of the lateral side of the elbow, and in golfer's elbow, it compresses more of the medial side of the elbow. Thank you.